Boa noite a todos. Bem-vindos a esta primeira sessão da Semana Europeia da Saúde Pública, este webinar. Já hoje de manhã houve o kick-off da Semana Europeia e nós na Associação Nacional de Médicos de Saúde Pública, enquanto membros da Federação Europeia de Saúde Pública, vamos também fazer webinars diários. Tendo em conta que o público é internacional, eu passaria agora para inglês para que mais pessoas possam seguir. So, good evening, everyone. We're just starting the first of the daily webinars we'll be having during this week at 9:30 p.m. Lisbon time to celebrate the European Public Health Week. The European Public Health Week, as you know, is an initiative from the European Public Health Association, which is a federation of public health associations across Europe. And this is the second year that we're organizing the week. And the goal of the week is to share knowledge and increase awareness on several issues that concern public health. So this year, it's a slightly different model because usually there would be lots of events which would be taking place all over Europe due to the current pandemic for COVID-19, where we needed to change that approach. So mostly there will be electronic events. So this is the first of the week. We'll have one, as I mentioned, on a daily basis. And I'm happy to welcome our guests for tonight. So we have Sara Cerdas. She's a medical doctor, and she's also a member of the European Parliament. We also have Alexandre Abrantes. He's a professor of public health at the National School of Public Health in Lisbon. And we'll also have Ricardo Batista Leite, who is also a medical doctor, and he's a member of the National Parliament here in Portugal. And so welcome to all of you. Welcome to our viewers as well. And today's topic concerns the Sustainable Development Goals and how health promotion can help in achieving those goals. As we all know, the SDGs, or the acronym for Sustainable Development Goals, are 17 areas where both developing and developed countries need to invest in order to improve the well-being and improve the development of the populations all over the world. So there's surely health included in those SDGs. And of course, there's a lot up for debate on what can be done on the different levels to raise awareness and to implement measures that enable us to be better achievers in the different roles and in different fields. So without further ado, I would now give the floor to Sara Cerdas. We'll have initially a brief speech from each of our guests, and we'll move on to the questions. So if you do have a question, please use the tools that are available in the platform to pose those questions, and we'll try our best to discuss them and to answer them. So, Sara, once again, you have the floor.
Thank you, Ricardo, and thank you everyone that's listening. I take this opportunity to greet my fellow panel colleagues and also to thank for the invitation to be speaking here at the European Public Health Week, which I know the public health professionals have been overwhelmed with work with the pandemic COVID-19. So this is it's even a bit more delightful to be here and gather and be a part of this discussion to discuss the Sustainable Development Goals and the work that is being done in the EU in order to achieve them. And given that health now is at the center of the agenda with the pandemic, everybody now knows a bit of what public health means, or at least they know a bit more of what public health means. And they also understand the importance of having robust healthcare systems and robust public health services. I would like just to begin with a bit of background note on the different SDGs and how the EU is working to achieve them or to go in line with the goals. We know that now we have a new commission. It started its work in December 2019. Now they're, of course, overcrowded with a massive amount of work. And if we didn't have an pandemic going on, we would be discussing right now the European Green Deal and the Farm to Fork strategy, as it was scheduled to be presented in April. The Farm to Fork strategy is one of the biggest plans. Now it's postponed, I think, to September, if I'm not mistaken. It's one of the biggest plans to have a complete overview of what comes from, as the name says, farm to the fork. And the main goal here is to reduce the nocive substances there is for human health and animal health as well, but also to have a bit of this, how can we have a sustainable food system and also healthy, sustainable food system. So a food system that delivers and increases the health of citizens. And this is a huge mark of the work we're developing at the EU level. Of course, now we are also adapting it to the new reality. And this reality is that most services stopped during the pandemic, but we had to assure that food wasn't off our tables, that food kept coming to the families, kept coming to as part of the minimum services. This is what I wanted to tell a bit about one of the biggest goals, which I think it's a shame that we are in 2020 and still in the planet, there's people that die of hunger, children that die of hunger. So this is one of the most heartbreaking goals. We still have hunger in the planet, and we need to do every effort that we can in order to work and achieve that goal as soon as possible. I'm not going to talk about the SDG 3, which relates to health. What I would talk about that a bit later, which is a bit more specific to the work I develop at the European Parliament. I am a co-chair of the Health Working Group at the European Parliament, which is a structure in the Commission that deals with public health and food safety. So I have the opportunity there also to put the most evidence on the table in order for the policymakers to make the mostly evidence-based policy making. That's the biggest goal I have in the European Parliament, to bring the science and the evidence to the table and cross it with the policies that we are making at the EU level. We have important work being developed, and one of the handicaps that this pandemic uncovered, we can say that this pandemic showed us the biggest inequities we have in society. And one of them was that we asked people to stay at home, but some houses are not as safe as others. And here I'm talking about domestic violence and what we can do to end this important stigma. I'm talking to you from Madeira. And in Madeira, we have big numbers on domestic violence. 1 in every 3 women here are suffering domestic violence. So it's an outermost region, so it has a peculiar and different population that it can be extrapolated to mainland, of course. But this is a serious issue, and how this pandemic also evolved into putting these issues up on the table. And this is part of the SDGs. Most of the goals are obviously related to that. That is the biggest challenge at EU level right now, which is the European Green Deal. The European Green Deal, very simple. We aim to be the first continent to become carbon neutral by 2050 and to reduce our emissions by 55% in 2030. And in order for that to happen, now we are establishing a just transition fund. We don't want to increase inequities. We don't want to increase increase these inequities. So we want to have a just transition fund, meaning finances for people to adapt to the new jobs in order for the new jobs, the new sectors, the new industries to become more environmental friendly, so we don't leave anyone behind. And for instance, I give an example about mines, and it's a very polluting sector. If we shut down a mine, we need to increase the competences of those workers so they don't get unemployed and they can work in another service in another sector. And this is very important, and it's something that we're actually going to talk just in 2 days at the plenary of the European Parliament. I know the European Parliament plenaries are open to everyone. I know the discussions of the plenary can be a bit boring, but there's some lively discussions coming out of it, and I guess most of you can follow it on Twitter. The juicy part comes out on Twitter, so if you follow that, you'll see how are we working in the bigger picture to give an answer to the SDGs. I'm not going too much into detail on the SDG 3 because I think we're going to talk about it, but just to give you the overview that at the European Parliament, we work mostly, if we do the parallel with prevention, we work mostly with primordial and primary prevention, meaning that we work at before to avoid the diseases happen. And this is very important because when I arrived to the European Parliament, people asked me my background. So I would say I'm a medical doctor in the field of public health. I'm still a resident in public health. I have a master's and I'm in the middle of a PhD. And they would say, okay, what is public health? And still, even though there's a committee dealing with public health at the European Parliament, still I grasp that at the EU level, most people don't have that clear picture that public health entails so much more than the healthcare sector. And this is something that we have been working with different political parties, which has been amazing. It has been a trans political parties work that we're developing in order to raise awareness on so many different topics that affect health, and they are not related at all to the healthcare sector, or at least directly to the healthcare sector. And just to finish my intervention, because healthcare provision is a competence of the member states at the European Union level, meaning that healthcare systems are the countries are in charge of their healthcare systems, but there's so many things we can do at the EU level, and this is something that we can discuss a bit further in this conference, because I think most of the work we're developing goes towards reaching the SDGs.
Thank you, Sara, for setting the background for the session, and actually mentioning something that sometimes is unclear for people outside of public health. Which is exactly what it means, what's the scope of public health in the different settings. And that's certainly something that we as public health professionals surely sometimes need to clear, that it's quite broad in its scope, and it involves certainly a lot of different fields. And I mean, there's like the policies of health in all policies, or the ability to influence different settings. But still, I mean, sometimes it's not easy for those outside of public health to realize how much that means and what the implications are, even for options they make in different ministries and different sections, that they have an impact on health. And eventually, on the debate, we might discuss. There's been this ongoing discussion on whether we need to choose between the economy and health, and it's surely for public health professionals, it doesn't make sense to discuss that, because of course both aspects go hand in hand. Well, without further delay, I will now give the floor to Alexandre Branch for his initial speech.
Yeah, thank you, Ricardo, for inviting me for this session. I'm thrilled to be on this series of webinars in Portugal on the very first day. And Sara, it's a pleasure to have met you. I had heard of you, but I had never seen you in person, I think. And it's difficult to talk after you because you are so articulate and glamorous, then that I have some difficulty in following your performance. In any case, the only way of somehow keeping you keeping attention is to be politically incorrect and say things that other people will not be able to say. And given my age, I think I can by now say whatever I think without fearing the punishment of my peers. I want to touch on 3 points. The first one, before talking about the Sustainable Development Goals, I think we need to at least mention their predecessors, the Millennium Development Goals. Then I will mention a little bit about the Sustainable Development Goals and how they compare with the Millennium Development Goals. And finally, you will understand that from this earlier discussion that there is a perennial pendulum discussion in public health, which is the infamous opposition between vertical programs and horizontal programs. And if you think about it, the Millennium Development Goals are about problems and programs to solve them, while the Sustainable Development Goals are about causes of the problems and horizontal solutions, multidisciplinary, multi-sector. And they are quite opposite approaches, which we in public health have discussed for years. And of course, we are all balkanized into sects. We are either for one or for the other. And I will try to balance and close my discussion by saying that one is not better than the other, but one is better for some problems, others is better for other problems. Let's get started with the MDGs. MDGs, I believe, was a great success. It was the first attempt of bringing together all countries around the world around 8 goals. And they were very clear, very simple. There were only 8. And of course, there were 21 targets, and there were even 60 indicators associated with those targets. But let me tell you one thing. I remember vividly landing in Mali, going to the Ministry of Health, and the minister showing me his dashboard, a dashboard with 8 goals, the 21 targets. Of course, he didn't have the 60 indicators, but he have at least 20 indicators and tried to have at least one indicator for each of the targets. So what I'm trying to say is this was quite adopted broadly, not only in developed countries, but also in developing countries. Second thing you have to realize is that they were a success because most countries in the world not only achieved those targets, but they actually surpassed them. And this was all around the world in all continents. Only a few countries in sub-Saharan Africa did not reach, and Haiti, of course, did not reach the Millennium Development Goals. All the others either reached them or surpassed them. So in that sense, I would say that they were a big success. Now, why were they a success? I think one was that because they were few, because they were very clear, and because, and this, take notice, there was money associated with it. The World Bank and the other multilateral development banks associated with the MDGs a $50 to $60 billion debt relief. So countries, to get the debt relief, had to align themselves behind these goals. And this worked. Of course, money always helps programs to develop. So this helped. Now, how were they good for health? They were very good for health, the Millennium Development Goals, because of the 8, 3 were specific health goals: maternal mortality, child health, and communicable diseases. And of the other 3, 2 were social determinants of health: poverty, hunger, women emancipation, women education, and 1 was environmental health, which was also related to health. So I would say 6 out of the 8 were either directly health or social or environmental determinants of health. So health was very highly represented in these development goals, and so I would say they were a success. Now let me move to the Sustainable Development Goals. The first complication with them is that they are no longer 8; they're now 17. There are not about 20 targets; there are 169 targets. And there are not 60 indicators, there are 232 indicators. So I fear that if Sarah or I travel to Burkina Faso and visit the minister, I find it very, very doubtful that the minister will have a dashboard with all these targets, indicators, and goals, and he will understand all of this. So in that sense, I think they are too complicated, too many of them, and too diffuse. If you look at the target goals themselves, many of them are not easy to explain to a lay person. They are complex constructions of an international bureaucracy. The second thing I'm worried about them is that there is no money associated with it. There is not the debt relief program associated with these goals. So, you know, we can all say what we want, and countries may actually make an exercise to develop the program and so forth. But after some time, not having an incentive to pursue this, it may not have the same fate that the Millennium Development Goals had. Finally, in terms of health, if you think about it, only 8 of the 17 goals are related to health. Only 1 is directly related to health. 5 are associated with social determinants of health, and 2 are associated with environmental determinants of health. So the message is much more diffuse and less focused on health. So I don't want to be parochial and say that the goals should all focus on health, but you know, if you compare the previous ones with these ones, from the health perspective, they serve us less well than the previous ones. Now, the estimate that to achieve these or achieve progress in these goals, the check is expected to be $2.5 trillion. Is it too much, too little? Well, it depends on where you sit. If you sit in the government of the United States, 2.5 trillion is probably not a huge amount, but it's even difficult to conceive what 2.5 trillion are and where you would get them. So let's move on from there. So what I was trying to say is that hidden in this discussion of the 8 versus the 17 is the question of the vertical programs and the horizontal programs. It's the disease control program versus the health in all policies. You know how this is a passionate discussion where the public health community is divided into sects which hate each other and call each other names. But I think this is a very destructive and silly discussion. I was educated at the School of Public Health in the 80s or 70s and 80s. And at the time, it was all about vertical programs: maternal health, child health, school health, communicable diseases, what was that? The diabetes and so forth. And then a few years later, I arrive at the World Bank, and there was an anathema against the vertical programs. It was all about health systems. So health systems were the solution. The vertical programs were inefficient. They had limits conceptually. They addressed the problem, but not the cause, and all of that. Well, it didn't last long. Early 2000, and what do we see? We see that the Gates Foundation is created and goes all the way into vertical programs, and they are the largest funder of international health programs. And you see the global fund financing tuberculosis, malaria, and AIDS. You see Gavi financing vaccination programs. You see Rollback Malaria financing a single disease program, and so forth. So the pendulum had swung again all the other way. To close, does this discussion, is it a useful discussion? I don't think it's a useful discussion. the vertical programs are very good to deal with specific and clear problems for which there are solutions, and the solutions are well known. The horizontal programs and the health in all policies and so forth are probably better to deal with problems which are less well defined, for which we don't have clear technology to deal with them, and which require multidisciplinary approaches and so forth. So if you want to deal with malaria or COVID-19, probably a focused effort on resolving the problem is probably more efficient than an horizontal approach. While if you are dealing with much more complex problems, then probably the horizontal approaches are wiser. And I have said, thank you.
Thank you, Alexandre. Well, that's also very insightful and food for thought, and certainly it can spark a discussion that I think will go on for the next hour or so. Well, I have to apologize because unfortunately Ricardo is running a little bit late. He had a media commitment, and I insisted that he take part in the panel. So he'll join us as soon as he can. But we already have some questions from our participants, from our audience, and two of the questions actually are interconnected. So Antonio Soares asks whether or not is it feasible to achieve 17 goals. And actually, as Alexandre already mentioned, it's much more than 17, because then there's within each of the goals, there's several indicators, and so therefore it's mostly a behemoth of different indicators that one must reach and one must achieve. So the question from Antonio is whether or not is it feasible, and also we have another question from an anonymous, which is it fair to compare different countries using the same targets? So whether or not the targets should be the same for all the countries, or whether different countries should have specific targets given their conditions. And I think that there was already mentioned that the fact that the goals initially set for the Millennium Development Goals were very, let's say, low, most countries didn't have a hard time in achieving those goals. And therefore, different goals might be difficult to achieve or easier to achieve given the context. So how would we sort of invest in trying to make different targets, different indicators according to the conditions of the country? Or should we be really aiming for at least a minimum across all countries that would enable at least some level of development that would be consistent with the sustained development, both on the economy and the personal and on the health level? So I give the floor back to our speakers on whether or not they want to comment these questions and or answer these questions, please.
I don't know if Alexandre wants to start this response, or if you want to go.
Go ahead first.
Okay.
I'll go next.
Okay, I'll give my perspective as a junior medical doctor, which is when we enter public health, we study the Millennium, but we also now we study the sustainable SDGs. And it's a bit overwhelming at the beginning because it's 17 with the sub goals and different indicators, different targets, and this can be a bit hard to grasp, as it was said before. For instance, to go to a ministry and tell me how are these goals in your country. But what I understand, and from these goals, what we can do with them is different programs that and tools, different mechanisms in order for them to reach different overarching goals. For instance, we have now the European Green Deal that clearly touches at least on 10 of these goals. And this is something that can help reach this by 2030. In regards to the second question, sorry. If it's fair to compare different countries, I would say it will be better to compare, as for instance, we have a system at the EU level, is to compare different regions by their income. And for instance, Portugal has 7 regions, but they're not all capped at the same level. They're capped at the different level of development they are in, and also through their specificity. So as I said before, I'm in Madeira, it's an outermost region. It has a different guide, and these goals, the sustainable development goals, should have a similar system in regards of how to reach those goals, in regards of there being low, middle, or high income countries. I think that's the word in English, how we classify the countries.
From my side, for answering Antonio, is it feasible? I think it will not be feasible for all the countries to deal with all of them. My bet is that each country will pick up on a few of these goals which make more sense for their particular situation, and that they will focus on those and then pay lip service on the others. That's a little bit of what I think will happen in the practical world. The second question from our colleague is about, is it fair to compare? Of course not. You cannot compare different income level countries across the world. I think comparison will probably be made among more homogeneous groups. But also, I think somehow what will come out after a few years of experience of this is that will probably be a simplified version of this to use in countries of lower income, even some of the middle income countries where this level of complexity is probably more hurtful than useful. So I assume that somehow there will be a minimum version of this that can be applied and that we can support developing nations to follow.
Well, curiously enough, that was actually one of the questions from M. Batista, was actually asking, what's the future for the SDGs? Will they be reviewed in the near future? And I would just like to add something, that eventually we need to look at the SDGs as a minimum for different countries, and that should be viewed as somehow a need for the global community to understand that we would all benefit if all the countries would reach those SDGs. Because in the end, I mean, as a community, as a global community, we would still need to be looking out for each other. And that would certainly mean that there will be increased health, increased economical benefit if all of us were certainly at a higher level or at the minimum level that those SDGs actually set. So that's actually very interesting in regard to the fact that how different countries view their approach to the SDGs. Of course, developed countries tend to look at the SDGs as to focus on more, let's say, on the green aspect of those SDGs, or on the economy side of those SDGs. But eventually, other countries with either low or middle income might be looking more towards either the health or the social determinants. So I think that's we all need to believe and to gain an approach where overall all of us need to be concerned about that. Well, I'm very happy to say that Ricardo Batista Leite has now joined us. So I'll let him breathe for 10 seconds more, and welcome, Ricardo. I'll give you the floor now for your initial presentation. Ricardo, as I mentioned, is a medical doctor, and he's currently a member of the national parliament here in Portugal. And he's also quite connected with the public health field through his different positions. So we do have a very public health panel tonight with us. So without any further ado, I'll now give the floor to Ricardo. Welcome to the panel.
Well, thank you so much, Ricardo, and hello to everyone. My apologies for being late for this session, and as probably Ricardo explained, I had previous commitments, but I'm happy I was able to join you in time. And despite the fact that I didn't hear the initial interventions by my colleagues, just a few words and then opening up to any questions you may have. But probably it would be most interesting to share some of my own experience also dealing with the SDGs at multiple levels, more from the political perspective. The truth is, dealing with the Sustainable Development Goals, most people outside of the bubbles that we normally work in public health or in global health or in multilateral organizations, most people are unaware of the SDGs. The truth is that most people don't even know they exist. And many times I hear politicians still referring to the Millennium Development Goals as being something we need to achieve. And so this goes to show that there's a lot of work that needs to be done. I was in 2015 when the SDGs were approved for the first time. In 2015, I was at the time vice mayor of the City Hall of Cascais and then city councillor. And that was a tremendous opportunity to be at the local level, working, and I had under my responsibility international relations and health strategy and policy for the city. And what we did was understanding that the Sustainable Development Goals could be a pillar to build on in terms of future strategy. We developed what we called Cascais, which is the name of our town, Cascais 2030, which became then a dashboard and became basically the way we developed our further strategy moving forward, looking at each of the goals. For a whole year, we adapted the 166 indicators to the local level. And what we did was all councillors, when presenting a proposal to the City Hall, they would have to submit it along through a digital process in which they would also have to fill in a form related to the SDGs. And then we nominated a chief sustainability officer that would fuel the dashboard. This became very important because then the dashboard becomes a tool that on a yearly basis we can use to see where we're lagging in terms of the 17 goals. And so basically when we say we can't leave anyone behind, we can't also leave any policy behind, we can't leave any goal behind. And so every year when redefining our own budget, we can see where we needed to invest more. And I love this example, and the mayor mentioned it a few times, because Cascais, in the Portuguese context, always won the awards for being the most sustainable city when it comes to environmental policies, especially energy policies. But when we applied the dashboard, we only had around 60% of the goals out of 100. In all of the other 17 goals, we were between 70 and 90%. That was the worst one. It was the one where we won most awards, which goes to show that many times awards are given more out of publicity and propaganda than necessarily from data. And that is what is critical, responding and trying to achieve the SDGs, that we are capable to monitor each of these indicators. But it is fundamental, that's why I'm sharing this initial local experience, to translate these global indicators into something that is tangible at the local level. Only if we are capable through cities, through our town, through our communities to achieve these goals will we be able to do so. And that takes me then to my other experience at the national level. I sit also on the Foreign Affairs Committee along with the Health Committee, and speaking with the government, trying to understand how they deal with the SDGs. Basically what the government did at the time when the SDGs was approved, they at the Foreign Affairs, they said, okay, each ministry would have to define who is their contact person for the SDGs. So there's okay, there's an agriculture person for food, there's a health person for SDG number 3, and so forth. And basically everybody had a vertical approach to their own goals. When what was intended by the authors of the SDGs in principle was to have a holistic view, a transversal view, a horizontal approach to all of the goals that would lead up to SDG 17, fostering partnerships between the public sector and the private sector, bringing in communities and the social sector, bringing in high-level national and multinational organizations along with grassroots community-based organizations. And that is something that is critical if we want to achieve the SDGs. And the truth is, most countries tend, due to the way governments are built, tend to have a verticalized approach in each of the areas, and we continue to not break down the silos that are necessary. One last word just to mention on SDG 3 specifically, and universal health coverage and health for all. The truth is, I think that COVID-19 may have helped us all understand even more clearly than, I think most public health people were already convinced that all 17 SDGs fuel towards the health, our health status and our well-being status. And in that sense, I think it is critical that we understand that when we speak about health, we need to speak about more than just health provision or health services that are used to react to disease. We need to make sure that we are focusing on each of the SDGs and how they impact on the well-being of the citizen. And that is the center point of the SDGs. That needs to be the center point, focusing on the well-being of the population, which means that if we are fighting hunger, we are capable of providing better health. If we are providing a more sustainable climate, we are providing better health. If we are capable of addressing gender inequalities, we are providing better health, because health needs to be perceived in this health and well-being concept, which is much broader, I think, than the one originally presented within SDG number 3. And that being said, I think we have a lot of work to be done. And I think that the world needs to revisit our goals for 2030 following this COVID-19 crisis, with all of the financial challenges we have ahead. Most probably, especially in low and middle income countries, it will be very difficult. Even beforehand, it was very difficult for us to achieve them. Now it's even harder. And so I really feel that we need to reassess. And if we want to keep the goals, then we need to reassess the way we're allocating resources, because domestic budgets alone will not achieve those goals.
Thank you, Ricardo, for this initial speech. Yeah, there's a lot of things that we're considering. You already mentioned that we need to probably have a local concern or a local approach to the SDGs. So it's kind of thinking about the usual think global but act local that we usually also tend to connect to. I would say that's certainly a view that also Sarah has mentioned, that different areas, different fields, of course, have different challenges. The different regions, of course, face different challenges. So they probably have also different approaches to sort their problems and to reach the goals that are set by the SDGs. And indeed, we know that this the impact of the pandemic actually will probably take a toll in several of the goals and objectives that all the world had set. But on the other hand, eventually, this might have been a wake-up call to realize that if we don't invest in prevention, in the ability to prevent this sort of problems, and also to have robust infrastructures that enable us to respond, that eventually might be a problem as well. Not exactly connecting with the SDGs, but for instance, within the international health regulations, there's also a need for countries to be capacitated with a minimum level to respond. And that's quite clear that if the whole community, the whole world is not at least capacitated to respond, we'll know that the weakest link will eventually be the one where the whole system has a problem to solve. And even if, as we realize that initially a country with the resources that China in the end mobilized, they in the beginning they probably downplayed the problem to an extent that they lost control of the situation very early. So I guess that having an approach that enables all countries to look back and think, these were the needs we already realized we had. We probably need to work towards making sure that these capacities are put in place before we face another challenge as the pandemic for COVID-19 has been. So hopefully, and I stress the hopefully, governments and the different actors will have to review what was their approach on also on the budgeting for public health in order to prevent these sort of situations in the future, because we have realized that the economic toll is very significant, and eventually if we were able to minimize the problem at an early stage, we probably wouldn't be facing the challenges that we're facing now across the whole world. I'm looking for the questions. I don't know if any of the speakers already wants to address something that was said either by Ricardo or what I've just mentioned. I'm looking for the questions now. So we have one question. Or Alessandro, do you want to?
No, I'm fine. Thank you.
Okay. So we have a question from Andre Peralta, which connects with what we're just saying. So are SDGs still attainable with the future economic crisis due to the COVID pandemic, or is COVID an opportunity for change and prioritize social development?
I can go for that first. Okay. I would say that at least in Portugal, the COVID-19 with all its problems and social, economic, and health impacts being negative has brought the public health to the fore. I believe the public health core will be stronger after COVID, both in terms of the legislative environment in which we will operate. You know that things that we could not even discuss, like containment of people and so forth. There were in the early days discussions about were they allowed in the Constitution, and whether they were or were not was irrelevant. The containment was actually enacted, and therefore what I'm saying is that the need for a good and strong public health core is now a reality, and the public health, which had been like the stepson of the health sector, showed up and was the one which showed up and came up with solutions and with all the surveillance and the control of the spread of the epidemic. Of course, the high-level, high-tech hospital system also responded very adequately, but they already had a high profile in the health services, and now it's the time that public health, I think, will come up on top, which it was not the case for the past 20 or 50 or 30 years.
Thank you. So the other questions are coming up. So if you still have some more, please do go to the platform and ask the questions. We will be looking forward to that. I would like to discuss with you as well on when we think of the goals. Do we need to set an in between an evaluation that allows us to correct whatever is not being done at the level we would wish it would be? What I mean is that whether or not the goals are set on a too long scale to be able to correct for the things that happen in between. So, for instance, the economic crisis, now the pandemic. So whether having closer targets, much more on a, let's say, either yearly or biannual basis would be more agreeable, or would be more achievable for the countries, and therefore be able to implement measures that would probably make them progress towards those goals on a shorter time, because of course it requires planning and resources, but still having it on such a long range, eventually, do you think it sort of makes countries not as motivated as they would be to achieve those goals?
Whom do you want to address this?
To the panel. So I don't know, Ricardo, you put your microphone on. Do you want to address the question?
Well, I can, and I guess it's a bit sequential to what Alexandre was saying, in the sense that it's not easy for us to envision that this $2 trillion a year effort that was expected before COVID-19, that was leading to a lot of resource mobilization to low and middle income countries, will continue afterwards. We're seeing tremendous efforts right now being focused more on the domestic front in most countries, and they are mostly focused on solving the economic disaster that is coming in the aftermath of COVID-19. I'm somewhat concerned, as we're seeing not only in Europe but across the board, of the lack of solidarity that we might be foreseeing in the future, and how that may have a very negative outcome in terms of the Sustainable Development Goals. And I mean, just think about it, how climate, for example, was so high on the agenda before the COVID-19 crisis. And now I think it is nearly impossible to mobilize resources for climate change at this point. And you already start hearing certain parts of society say, no need to invest in climate anymore. These 2 months have done more than 10 years of changing policies. And this is a tremendous fallacy, if you will, in the sense that, if anything, yes, it's true, this had a tremendous impact, but we should use this in our favor. It doesn't mean, open up those coal factories again. And so I'm very concerned about how countries will deal with this. I think there is a very strong need for multilateral organizations to step up. We are somewhat disappointed with the lack of leadership from the United Nations, I would say, right now. One would expect that the United Nations could unite the world in this combat, and we haven't seen much. And the UN system, I think, is of course being pulled apart, and the US has played a very active role in creating distrust, particularly in terms of the World Health Organization. But this is those kind of moments. This is a crisis moment in which the UN has to show that it is valuable and that it can unite people in terms of the goals. And our Secretary General, the Portuguese Antonio Guterres, has an opportunity to show his leadership and to be able to not only bring in together all of the different agencies to lead a front against COVID-19, but also preparing the world for post-COVID-19. And the SDGs can be the platform to do so, even if it's to rethink how we're going to achieve them. And we're all feeling that these multilateral systems are somewhat paralyzed in their own tracks, and we need that leadership at this point to be able to move forward.
Thank you. Thank you, Ricardo. Well, we have a question which connects to the trillions we were just discussing. And actually, João Pedro asks us, where do you get the money to reach the SDGs? So who should be, where do the funds come from in order to reach those SDGs? So do we think that governments should support those actions, or is there also a role for either the private sector to contribute to achieve those goals?
I can start with this. One thing is the developed nations, they will have to find their own resources to deal with this. That's how things are done. There may be some like the European Union support for this, but basically this is an agenda which has to be financed by each country. When you're talking about developing countries, then you have to think about the multilateral agencies. And the multilateral agencies is not the UN. The UN is penniless. You have to think about the banks, not the World Bank, IMF, the Inter-American Development Bank, the African American Bank, and so forth, all the regional banks. And somehow they have probably to find some kind of instrument parallel to the debt relief effort which was used before, and to see if they can support this. I know each of these banks has already a Sustainable Development Goal fund, but they don't have money. Those funds have not been filled. They even thought about finding some kind of performance bonds associated with them, but that's more rhetoric than money. So, but we'll have to see. But going back to your question, by now 5 years have elapsed since 2015, and by now we should be evaluating progress done in the goals. And I'm not sure that is being done yet, which is a little surprising. It will be more difficult than with the Millennium Development Goals. Number one, because the goals are much more diffuse and than the ones of the Millennium Development Goals. And the time lag between action and results in these new goals are longer than the ones in the previous goals. For instance, to achieve a reduction in maternal mortality, it takes a couple of years because the cycle is 9 months of the pregnancy, and so you can get results relatively quickly. For the Sustainable Development Goals, most of these goals are long-term, and the cause and the effect are more diffuse, take longer to achieve, so it will be more difficult to track. So we'll see. I would just want to bring the discussion that Ricardo late was bringing, that the COVID killed, or somehow hit the environmental agenda or the climate agenda. Well, don't forget about the plastics agenda. You know, a year ago we were all talking about reducing plastics, this and that, and now I've never seen so much plastic around me as since COVID-19 started. On the multilateralism and UN, it's no these days. You know, it's not only the US which is gone looking inwards. It happens all around, and the UN, of course, yes, they are now being let's say, called names, but this is a process which has started a long time ago. The politicization of the UN structure and the appointment of people and the disappearance of a meritocracy in the UN has, after 20 years of it, they are now paying the price for it, and therefore it will take time. It will take time to regain the confidence of the world and regain the prestige they once had.
Thank you. One question that is also popping to my mind is, we're always looking at the SDGs as something we're getting closer. So as countries develop, certainly we should be getting closer to the SDGs. And I'll address this question to Sara now. Do you think that, given the current situation, both the pandemic and the probably ensuing economic crisis that will follow, do you fear that the progress that was being done towards the goals might be hindered, and that would actually be getting further away from those goals? Do you feel that's a problem, and how do you think we should or could intervene in order to reduce that risk?
Yeah, that's an excellent question, because now we're talking about pandemic. I'm a firm believer that when something goes wrong, we should learn from it and we should take the lesson home in order for it not to happen again, or if it happens again, we're better prepared for that. And that's a bit how I view this pandemic and the response to this pandemic. We know, for instance, of course, some of the SDGs goals can get behind at this moment, at this short term, where everybody is just focused into getting this virus out, or focused on treatment, vaccines, but also containment and surveillance of the different epidemic status in each of the regions. What I envision for this afterwards, and that's actually what we are already discussing at the European Parliament, is how can we use this pause that came at a great effort from many sectors that will become undeniably into an very important economic crisis, is how can we use this to have a strong recovery. Okay, I was just with the Portuguese word in my head, with a strong recovery and the sustainable recovery, because I understand what Ricardo said, that people are not talking about climate change anymore. Somehow Greta was really up and coming in January, and now I don't think we don't talk about it anymore. And the movement about the youth movement, which was really important, just to put the topic up high in the agenda. But what I want to say here and share with you is that the European Parliament and the European Commission, we have been seeing that there's a strong commitment to put the recovery plan that is going to be presented in the next few days, we hope, to put the plan aligned with the European Green Deal, in order for us to tackle two rabbits at once, as we say in Portuguese. So in order for us to keep going in the track of going with the European Green Deal, which indeed with the overarching and horizontal approach we hope it goes, we can reach some of the SDGs, as it was said before, Ricardo and Alexandre. The SDGs are interlinked, and it's supposed to reach to goal number 17, and that's what we are working at that level, and we are discussing at that level. I just want to comment a bit on what Alexandre said about plastics. That was something that really struck my mind, because now we see masks and gloves everywhere in the streets, even so, not even in the garbage disposable places. But I just want to share that, at least as far as I know, and I sit in that committee, there hasn't been a postponement in the directive for single plastic use. So we're going with that at the EU level for 2021. So I'm quite interested. I'm sure the health will have an exception here, of course, health materials. But I'm quite looking forward to see how we can adapt to that, even though that now we're all eyes on the pandemic. So just to summarize my response, I do hope this pandemic could lead for the SDGs not to stay behind, but also for them to boost to the front with the socio-economical recovery that we need, and not only at the EU level, but also at the country level, but also at the regional and city level, because different cities were hindered differently.
Thank you, Sarah. Something that we've also been discussing is due to the disruption in the whole global market. And for instance, for both drugs and vaccines, we're all dependent on some countries. Do you think that the SDGs, or maybe a more not necessarily connected with the SDGs, do we need to rethink our supply chains so that we're not as dependent on some countries for them to supply both the drugs and the medical supplies that for instance, we faced significant shortages for medical supplies in the early stages of the epidemic, and this was widespread throughout the whole world. Do you think that also there's a role for the SDGs sort of to balance this distribution in a way that different countries, be them developed countries or developing ones, or high income or low income countries able to reach let's say the same level of supplies. For instance, we've been discussing the investment on malaria research for quite so long. Apparently, if the problems are faced by the countries with the highest incomes, then there seems to be a much more higher availability of resources to do research in those fields. So do you think that also the SDGs should play a role sort of in balancing the field for the approaches we need, both for research but also for supplies to different countries? I'm not addressing it to anybody. So Ricardo, do you want to answer that?
Well, yeah, I just before deep diving into that, just to say that I fully agree with something you were mentioning before. We need to make sure that we monitor the SDGs very closely, and I think that the only way to do that is to translate these global indicators to the very national and even local level. Without doing that, we will not achieve them. And as Alexandre was saying, you know, these indicators are much harder to hit and to achieve than...
Ricardo, let me just interrupt you for 1 second. One of the questions from our viewers is actually, who's measuring the SDGs and what are actually the consequences if not reaching those goals? So we do need to measure, as you're mentioning, but if we don't reach those goals, what are the implications for that?
Well, the implications are living in a worse world than we could, and there is no penalty, so to say, for the countries that do not achieve them. But countries have committed, and it is a commitment that was made in 2015, and that I think should, you know, not only countries but also businesses work together to strive and to make sure that we hit those targets. The thing is, you know, as Sara was saying, all eyes are on the pandemic right now. People have lost focus, I think, to this holistic approach, and they're very narrow focused. And once again, I think it's the role of the multilateral organizations to reopen the views of those in leadership positions, because it's very difficult for those at the local and national level to not be narrow-sighted right now, because the pandemic is what people are knocking at their doors about, and they're concerned about their national health systems not being able to react. They're seeing their economies at the verge of collapse, and so there's a lot of concern there. But we do need to measure, and honestly, I think if we do have a lot of institutions responding to the viewer, we do have a lot of institutions that try to monitor how countries are responding to each of the 17 SDGs. But honestly, these approaches, once again, I think they're too macro. I think we need to translate the SDGs into what they mean for people on the ground in the real world. And that is the kind of local translation that, you know, I started my first intervention here mentioning how at the city level, one can try to translate at least the SDGs, you know, to what does that mean? I'll give you one concrete example. Universal health coverage. What does that mean for each citizen? It might mean, for example, the way we did in Cascais, to make sure that each citizen has access to their family doctor. And so that is a very simple way to translate a very complex concept. And we need to find ways to translate this so that people understand what's in it for me, so they can also be engaged. And I also think we need to do the same with companies. UN Compact was trying to bring in companies to work around the SDGs, to work, you know, between UN agencies and the private sector, trying to foster private investment towards the Sustainable Development Goals. But, you know, I participated in many of the meetings that involved these companies, and at the end, they showed good intention, but they really didn't see how they could really translate their intentions into actions. And this went on for years now. And the truth is, there is potential. And I agree with Alexandre. We need those regional banks. We need the global institutions that have the funding capabilities. But we just heard Kristalina Georgieva, the head of the IMF, saying we have a war chest to respond to the COVID crisis. That war chest is a lot of money that is now being deviated from other situations like the SDGs. And that is where, you know, the global institutions are at the same level as the national in terms of that difficulty of understanding that we need to continue moving forward. And that's why I'm saying, I think maybe we do need an honest conversation to understand what is achievable truly. And if that means reassessing those goals for 2030, I prefer a realistic approach than just failing across the board because we decided for a whole decade to pretend we're going to reach them and we're not. And I think that's a very difficult but needed conversation between countries so that we can commit to something that is very real. Lastly, and what you were mentioning about basically the redistribution of industrial powers and responses and our capability of interdependence or becoming more resilient in terms of our own independence. I think that clearly we are seeing, China and Southeast Asia, many of these countries are going to be the economic champions of this COVID crisis. We're already seeing that. And I think that this is a time for us to go back to our Atlantic roots and for Europe to re-engage in terms of its North Atlantic relationships with Canada and the United States, and to form an economic bloc that can create a certain form of independence in terms of supply chains. I agree that this is needed. Also due to economic theory. I mean, having one single, having dependence to one single market in terms of resources generates situations of monopoly, which of course generates situations of risks. And because there may be a problem in terms of the supply chain, as we're seeing now, that then compromises our global effort. To have multiple capabilities of response actually fosters a more competitive environment that then fosters greater innovation. We have seen that in the past. I think we laid our, we were comfortable in the situation. It was very easy. It was very cheap. We weren't asking many questions about how it was getting so cheap. We just wanted the world to move faster and faster forward. And maybe now is the time to use this crisis to rethink our positioning and our strategy. And actually, I see this as an opportunity for us to come out of the ruins of the COVID crisis as the European Union, regaining the strength, understanding that we have, and you can see it now, we're talking about treatments, vaccines, medical technologies. Most of it is coming out of the North Atlantic between the US and Europe in terms of development. And we still have that small lead in the global market that we should continue to foster to be able to be competitive in the future. Or else I believe that Europe will just become a museum where everybody else comes to visit. And I think that we cannot allow that to happen because we have tremendous capabilities and an amazing population willing to participate in the global conversation.
Thank you, Ricardo. Well, we're heading towards the end of this webinar. We still have a couple of questions pending from the audience. I would like to ask briefly what your take is on the changes that we've so suddenly taken during this pandemic. Might have taken for a lot longer. How do you see the impact of those changes in the SDGs? I'm thinking about the changes, for instance, in working from home, or the fact that we're using a lot less of transportation now, or the fact that so many of the civil society have gotten together and developed technology to address specific needs. I'm thinking about, for instance, the ventilators that some groups in Portugal have just gathered engineers and technicians and doctors together in developing these very simple solutions that might be able to give a response to very critical patients, and whether we should use those recently acquired capabilities to sort of direct them towards solving some of these problems that we're facing within the 17 goals. Do you see how can we all foster this in order to make it a more perennial approach, and not just something that happens when we have a crisis and need to tackle it on a real-time basis. Alexandre, you are asking for you need to...
I can start with
Yes.
your first. Before going into the last question, let me just briefly touch on your earlier question. I think we have lived for many years now, maybe 30 years, on the move towards globalization. Products would be produced wherever they were produced more cheaply or more efficiently, and we would rely on international trade. You had seen this going back since Trump took office, and they were already retrenching and becoming of the view that each country has to have their own strategic reserves and capacity not to depend on international markets. I think this played along with the COVID-19. I think COVID-19 transformed the view that public health is a health problem to the view that public health is a security problem. It's not just a public health problem, it's a security problem. And once you start talking about the security problem, you start talking about strategic reserves and strategic capacity within country or within alliances of countries. And therefore, I anticipate that a lot of the globalization and purchasing things in India and in Vietnam and so forth, that the European and the US will probably want to have some reserve capacity in their own countries as opposed to relying on those markets. Going as for the technical opportunities that this COVID-19 brought to us, the one which has struck me most has been the use of big data, which is collected for, we don't know what, by Apple, by Google, and whatever, can be used for public health. When I suddenly saw the numbers of Google and Apple about our mobility, I realized that they didn't collect this data to ascertain our mobility in terms of public health and how this would impact us. But these are data which are very, very useful to do epidemiological diagnosis and actually to be able to have what I call the precision public health. It allows us to precisely identify the behaviors of people in Mursa or in Sortella, as opposed to have these big numbers of national statistics which are published every year. This is an extremely interesting source of data, and that I forecast that in a few years we will be able to basically describe the public health DNA of each community.
Thank you, Alexandre. So unfortunately, our time is almost over. So I'll now give the floor to each of our amazing speakers to give us a 2-minute last message on what they want to stress about the SDGs and how in the future we can reach those goals on a more effective way. So I'll take the order that were the initial intervention. So first, Sarah, please.
Okay, thank you. Thank you very much again for having me here. And my last message is that we are deeply committed at the EU level to reach SDGs and be a lighthouse for others to pursue these goals. Even though that we talked today about the main issues behind the SDGs and how unattainable they are, Ricardo gave a clear example, an impressive and amazing example on how SDGs can be translated from global to local level. And that is something that we should do and that should be done in order to make these SDGs more attainable. In another sphere, just to say that most of the links of the sectors are related to public health, and it's such a joy to talk with public health with such an amazing panel. And I hope to see engagement from society give answers to public health problems and not only covering public health when you need. I mean, public health work is a backstage work. We don't like to be on the spotlight because that means that something seriously wrong happened, as it happened in this pandemic. What we need is more recognition for the public health work, more capacities and better resources in order to fulfill this work, which I think is of the utmost importance in order for the SDGs to be reached. So thank you very much again for the invitation and for having me here.
Thank you, Sara. Alexandre, please.
Thank you very much, Ricardo, for the opportunity. I had a great time in this conversation. Glad to meet you, Ricardo, and Sara. Hope to see you soon again.
Thank you so much. And finally, Ricardo.
Well, thank you, Ricardo, for organizing this. It was great to meet both Sara and Alexandre. And congratulations, Ricardo, also for your leadership here in Portugal with the Association of Public Health Doctors. And to say, I mean, when we signed on the SDGs back in 2015, we could not foresee what would be hitting us 5 years later. And I think it goes to show that we should be humble in the way we look at the world, and especially dealing with these global health challenges. And what Alexandre said is so true, that public health, global health are of national, but also of global interest. They are security issues that we need to deal with. And by revising the SDGs, we need to include preparedness and response for public health emergencies at the core, to make sure that we are capable, as Sara was saying, to give the needed resources, but also the organizational capacity and national and multinational coordination that these organizations needed. In the past, following World War II, we were capable of understanding the importance of deterrence and military power to provide safety and security, and we've done that here in our region through NATO. We need now to do the same when it comes to global health threats.
Thank you so much, Ricardo. So now it's my task to close the session. Thank you so much for those very inspiring presentations from our three speakers. Thank you as well to the roughly 250 people that were watching the webinar, and for the questions as well. And we'll be looking forward to hear from you and to see you over the next 4 days. We'll have a webinar daily at 9:30 p.m. Lisbon time. Do join us. We'll be looking forward to discussing different public health issues over this Public Health Week organized by the European Public Health Association. And surely the challenges that we're all facing within public health need to be tackled, and we need to find the tools to make those ideas, those projects that several of you mentioned, to turn them into reality, and especially to make them real for the people, because often we're discussing this on a very high level, and it's somehow difficult to take the message to those who are really on a local level, on their daily life. How does that impact their life? How does that impact the life of their children? So indeed, this is a difficult task also to communicate this. So hopefully this webinar will also help share these views with different people. So once again, thank you both to our speakers, to our viewers, and see you soon. All the best. And we need to implement public health